Hi, I'm Dr. Steve Goeddeke from Accel Chiropractic in Grandville, Michigan. We have had a lot of new viewers to our channel recently, so I wanted to take a quick minute to talk about the purpose of this channel a little bit more. Of course, I would like to build my own personal brand in my office. That would be great, and get the word out. But I also want to do a few other things. We want to document an adjusting process that I've developed over the last 5 or 10 years that I found gets really quickly to the heart of the problem, and we can get the patients better very fast this way. Going through school, I learned a number of different techniques in chiropractic, and they're great, and some of them are better than others. Some of them have a lot of really stringent criteria, and they use even very complex technology like thermal scanners and things like that, EMGs, to document before and afterwards. That stuff's all great, but it's nice to be able to do things that are very easy and quick with a patient. We use a lot of muscle tests and orthopedic tests, the same orthopedic tests that all chiropractors, medical doctors, physical therapists, they all learn and everyone's familiar with. I want to demonstrate the possibilities of what we can do with this work to other chiropractors, physical therapists, and medical doctors. Like I said, we all learn the same orthopedic tests in school. There's a handful of them. We stress the lower back, for instance, in a lot of different ways with the patient either standing or laying down, and we run all these same tests at our office. We don't use them the same way though. Most of the time what we were taught is to diagnose which tissues are affected, if the patient has a disc bulge or facet syndrome or things like that. And it's great to be able to diagnose that. But what I've done is I've taken these same orthopedic tests and I use them for before and after checks with patients. And we find that most of these orthopedic tests we can clear out in the drop of a hat with 1 or 2 key adjustments in the right areas at the right time. My wife, who's an athletic trainer by trade, she learned all the same orthopedic tests that we do. And they used to do these tests with athletes all the time. When she sees what we can do with people, how they can go from failing an orthopedic test or failing 3 or 4 or 5 of them just in one area, and they start passing them within just the timing of that first adjustment, it's shocking to her, and it'd be shocking to a lot of other healthcare professionals to know that that's a possibility. We want to bring back the art of chiropractic. My profession, the way I see it, the politics and the progression of my profession over the last several years is the art is really dying. A lot of people get out of school, they have a lot of loans to pay off, they want to build these huge practices, and they want to sell care plans, getting people to come in 30, 40, 50, 60 times within a year. And a lot of people do get really great results with that, but there are levels to this chiropractic art. And you can get a certain level of results here. Say you do some very, very simple moves with people, you get 70% of your patients better. That's great. If you learn a little bit more, you can get 80, 90, 95% or more better. I think out of 200 new patients or so that I saw last year, there were about 2 that I found I couldn't help. So there are lots of people that can be helped by this. In fact, most can, that are dealing with any kind of lower back or neck or any issue in their body, whether that's shoulder or hip or anything like that. So by all this, we want to just demonstrate the art a little bit more and get some other healthcare providers to see this stuff and be aware of what can be done. When I was learning my own skills and building my own technique over the last 10 years, I watched other YouTube channels at different points, and one of those is Dr. Gregory Johnson with the Ring Dinger in Texas. That's awesome stuff. There's a Dr. Bo Hightower that I've watched before, and these guys are doing awesome stuff. And what I want to do is further this even a little bit more and help to share what I'm doing, and hopefully that contributes to the overall movement and the overall development of better and better and better technique in the profession, and that leads to better patient results, better building of our brand equity as chiropractors, because people are reliably getting better faster and faster, and this is just a no-brainer after a while, because the costs of doing chiropractic are very, very small, and the benefits can be very, very high. You can get people better very quickly. So that's just the purpose of my channel, and we're going to talk more about that as we go. Just keep tuned for more videos to come out, and please give us a like and a follow. Thanks.